and we welcome all of you to this presentation today. We're thrilled to be doing this, not just here on Zoom, but we're also doing it on Facebook Live. And it's also going to be recorded and posted on the Thanks Mom and Dad Fund website from today forward. We're pleased to be doing this during open enrollment. And the Thanks Mom and Dad Fund is especially pleased to remember back to the early 2000s. I think between 2002 and 2005, we were actually a part of a large coalition that helped to rebrand Georgia's state health insurance program, the state shipping program, to the moniker of GeorgiaCares. So we go way back with working with GeorgiaCares, and we're thrilled that they are able to provide the information today. We welcome our speaker and many of the providers who are also joining us. And today's speaker, I'd love to introduce to you. She's Christine Williams. She's the team lead for the GeorgiaCares State Health Insurance Assistance Program at the Department of Human Services, Division of Aging Services. GeorgiaCares SHIP provides free and unbiased Medicare information to individuals. Christine manages a team of certified Medicare counselors. She has the heart of a teacher, and she's passionate about education. We couldn't have a better speaker today. She also likes to garden and spend time with her family, so we'll probably know what she's headed towards this weekend. We're really glad that we could do this as a public service to Georgia's seniors as they prepare, and to our friends who've called in from other states, because you too have just a couple more weeks, and Christine's going to tell you more about that and open enrollment. Thank you, Christine.
All right. Thank you, Maureen. I appreciate you guys asking me today to speak. So I thank David Kaufman as well as you, Maureen, to allow me this opportunity to really share information about Medicare open enrollment. It's so important that folks take the time to really look at their health and drug coverage during this time because it is provided one time a year. And so again, I'll go ahead and get started with my PowerPoint presentation. If you have any questions, feel free to chat your questions in, and then we can review those questions at the end if there's any questions that you may have. All
Thank
right.
you, Christine. And we'll also introduce the providers who have joined us today as well. So thank you very much.
Very good. All right, so we'll go ahead and get started. Hopefully everyone can see my screen. We have our Stronger Families for a Stronger Georgia, which is the Department of Human Services, our vision statement. And now today I'm going to talk to you guys about the GeorgiaCares State Health Insurance Assistance Program, who we are and what we do. We will also review information about Medicare, Original Medicare, Part A and Part B, as well as Medicare Preventative Services. We will talk about Medicare Supplement Insurance, also known as Medigap policies. And we will talk about Medicare Advantage Plans, Part C, and then of course, open enrollment, as well as Medicare webinars, and then how to contact your GeorgiaCares State Health Insurance Assistance Program. So the SHIP program is a program that is federally funded through the Administration of Community Living, as well as the Centers for Medicare and Medicaid Services. We actually provide information to individuals. We are able to provide counseling, phone counseling, and in-person counseling, more so before COVID-19, but we are providing video conferencing for folks too. So if they would like to schedule a one-on-one video conference with us, we are accommodating folks to do so. And those that, again, are really unable to access our services, we are providing one-on-one counseling on a very limited basis at this time. So we are talking about educating individuals about wellness and preventative services. We also talk about financial assistance programs, and we screen them because we know healthcare costs could be something that a lot of individuals are unable to pay for. And so we do screen for 2 financial assistance programs. We also help individuals file appeals and grievances in dealing with Medicare. Again, we talk about all parts of Medicare, plans, as well as Medicare supplement insurance. And then we do provide impartial and personalized counseling to individuals. We have an education component also. So before COVID, we are out in the community. We're partnering with folks, churches, nonprofits, our senior centers. So again, just really trying to stay as much as possible to have community partnerships and accessing and providing services to individuals. All right. So what is Medicare? I'm going to start from the beginning. Medicare is health insurance for folks that are 65 and older. If you are under the age of 65, you would have applied through the Social Security Administration. You may be deemed permanently disabled, meeting the Social Security requirements, and then you too will be eligible for Medicare. There is a 24-month waiting period, though, if you are permanently disabled. So on that 25th month is when you will receive your Medicare card. And what you see on the screen is just a sample of what a Medicare card looks like. And when we counsel folks, we really try to kind of identify the card, because you may have a lot of health insurance cards or things that you carry with you. So we refer to it as the red, white, and blue card. So that's easily identifiable for folks to be able to pick that card out of all their many cards and then give us that Medicare number if needed. We also, Medicare folks can access Medicare if they have Lou Gehrig's disease without a waiting period. And then at any age, if you have end-stage renal disease, which is permanent kidney failure. So you are also eligible for Medicare. You can get Medicare if you are a United States citizen or you are lawfully present in the United States. You too are entitled to Medicare. So, in thinking about Medicare, there are some decision points that folks would need to really think about. How do I want to get my Medicare coverage? Should I select original Medicare or a Medicare Advantage plan? Should I take Medicare Part A or Part B, and when should I do so? How do I or when do I need a Medigap policy? What about Medicare Part D, prescription drug coverage? And then what do I do if I'm not retiring at the age of 65, which are all good questions and things that we receive in counseling that we provide to individuals as they're starting to learn about Medicare. There are 4 parts to Medicare. Medicare has what is called original Medicare and a Medicare Advantage plan option. So under original Medicare, you have Medicare Part A and Part B, which is your hospital coverage as well as your medical coverage. And then you have what is also known as Medicare Advantage plans, and they are an all-in-one alternative to original Medicare. So you're able to get your Medicare Part A and B, and sometimes also D under your Medicare Advantage plans. And then we also have what are called standalone prescription drug plans. So for folks that may need that option, it is also available. So through private insurance companies. And so the slide you see here really kind of mirrors what is in the Medicare and You handbook. So hopefully folks have that available and they are able to access that. If you do not and would like a Medicare and You handbook, you can go to the Medicare.gov website and download an electronic copy. There's a lot of good information on the Medicare.gov website. It's free publications that are available to anyone. So this slide kind of talks about the 2 main ways you will receive Medicare, again, under original Medicare or a Medicare Advantage plan. And we're going to go through those options because those are the questions that we receive a lot from folks. What option should I choose? Which one is best for me? And then also, how do I decide? And so it really helps to have a visual to see what your options are as you look through this process. So the first set of questions that we get are dealing with Medicare Part A. Do I need to sign up for my hospital insurance? Well, it is free for most folks. They've paid over 10 years into the system. They've had what's called FICA taxes, your Federal Insurance Contributions Act, taken out of your paycheck while you were working. And so most folks will have a premium-free Part A when they are eligible for Medicare. It is based upon your work history. If you do not have enough credits or work credits, then you may have to pay a monthly fee for your Medicare Part A. For some folks, though, we tell them you can talk to your benefits administrator at your place of employment, especially if they are participating in a health savings account and if you're still working. So we want to make sure that they avoid any of those IRS tax penalties if they are still working. So your Medicare Part A hospital insurance covers anything that is medically necessary for you. So for most folks, they have coverage if they are admitted into the hospital. So inpatient hospital care. Now, due to COVID-19, Medicare has made a lot of changes. So CMS has changed some of the rules in dealing with requirements of going into the hospital, how long you stay, things like that. Just due to the national pandemic, they're making sure that folks can access their services. And so, again, if you're in the hospital, you're getting all the services that you would normally get. And then also, if you are admitted into a skilled nursing facility, so needing rehab services. Some of the requirements are no longer applicable just due to the national pandemic. They've changed those to make sure that folks are able to access services. Also covered under Medicare Part A is your blood. So again, if you have surgery and you need blood, Medicare Part A will cover that, as well as some inpatient, non-religious, non-medical institutions. They too are covered under Medicare Part A. And home health care services are covered under Medicare Part A, as well as hospice care. So hospice care is if the physician thinks that you have less than 6 months to live, then you may be eligible for hospice care in your home or at a facility. Some of the things that traditionally are not covered by original Medicare under Part A is a private duty nursing, and previously it was private rooms, but just of course due to quarantine requirements, and then televisions and phones in your room, as well as some personal care items. So we try to make the distinction to make sure that people know that Medicare Part A doesn't cover everything. So if you have your red, white, and blue card and you have Medicare, Medicare will be paying 80% of those bills for you. And so there is some out-of-pocket costs that folks need to be aware of if you only have your Medicare card. So that's why it's so important that we make sure that people understand that your Medicare card alone may not be enough coverage for you. You may need to have some additional coverage to help pay for some of those out-of-pocket costs, or choose another option of how you get your Medicare coverage, say possibly through a Medicare Advantage plan. So here are some of the costs. I have the 2020 and then also the 2021 costs are listed. They were released this month by the Centers for Medicare and Medicaid Services. And so if you are in the hospital, there is a deductible if you have your original Medicare. And so you can see the costs that are listed here. Most folks, if they have just original Medicare, those first 60 days, you won't have any co-insurance. But then after that, there will be a per day charge. And so again, not to alarm folks, but to make sure that you're aware that there are out-of-pocket costs associated with original Medicare if you choose that option. Also with skilled nursing facilities, you'll screen some of the costs. The first 20 days, there's no cost for that. And then there's a per day charge after that. And you can see some of the costs have slightly increased from this year for 2021. And then also home health care services, again, are included under Medicare Part A. Most folks don't pay any charges for their home health care services, but you do pay a 20% for any durable medical equipment. So now we're going to talk about Medicare Part B. And that is your medical coverage. Most folks do pay a monthly premium for their Medicare Part B. It is normally deducted right from their Social Security check or their railroad retirement benefits. It is a monthly fee. So we make sure folks understand what that amount is and that it will come out of their Social Security check or some other way of making a payment. If you do not choose that option, you can have it deducted from your checking account also. So for some folks, if they're still working, we make sure that they talk to their place of employment, their benefits administrator, to understand that once they reach that age of 65, how their current insurance will work with if there is any requirements that they would need to do. So again, we do refer folks back to their benefits administrator if they're still working or if they're about to retire to see if they would have any retiree coverage. So your Part B medical insurance helps cover anything that is medically necessary. So we're talking about your doctor services, your outpatient and surgical services and supplies, any of your clinical laboratory tests, as well as durable medical equipment, diabetic testing supplies, also preventative services. So we talk a lot about preventative services. We want folks to try to stay as healthy as possible. And of course, the flu shot, getting your yearly wellness visits, and then also home healthcare services are covered under Medicare Part B also. What are some of the costs in dealing with original Medicare and Part B? Well, you do have your standard monthly premium. So next year that will be increasing to $108.50. And this year it is 144.60. And then also the yearly deductible next year will slightly increase to and $3 for the year. When we talk and counsel folks, a lot of times we do just do a brief overview and to make sure that they fully understand the difference between a monthly premium, what is a yearly deductible, and what is a co-insurance versus a co-payment. So they sound so similar. And so we want to make sure that when you're dealing with health insurance, you do know that a co-insurance may be a percentage of the amount that you would have to pay for a service versus a copayment being a certain amount that you pay when you go see a provider. And so again, terminology is very similar, but can be confusing at times. And so you may have a monthly premium, you may be subject and have a deductible. You may also have to pay a co-insurance, and then it could possibly be a copayment. So we just want to make sure that folks understand some technologies. Right. So Medicare Part B preventative services. So this is a lot of good information in dealing with Medicare preventative services. So I encourage folks to go to the Medicare.gov website. If they have their Medicare and You handbook, it has a lot of good information in your Medicare and You handbook. So if you can see that, it has a lot of good information about what Medicare covers. And so again, it has Medicare preventative services. Actually starts, I think, on page 30 in your Medicare and You handbook. And it will cover all the information, all the preventative services that you are entitled to as a Medicare beneficiary. So it's good to take the time to kind of look through either the handbook or go onto the website to see what preventative services that are available. If you are new to Medicare, you are entitled to a Welcome to Medicare preventative visit. So you are new, you have just signed up, you may be 65 and older, and you have your Medicare Part B. We encourage you to contact your physician and make an appointment for your Welcome to Medicare preventative visit. Of course, you can have that also by telehealth. So again, in staying healthy, or you say you can schedule a telehealth appointment via video like we're doing now, or also over the telehealth services are available for Medicare beneficiaries. And then also, if you have Medicare and been on Medicare for a while, you are entitled to a yearly wellness visit. So the difference between a yearly wellness visit and just a general physical that you would get from your physician is that during your yearly wellness visit, you will fill out what is called a health risk assessment. And that will allow you and your physician to discuss what preventative services that might be most appropriate for you. So again, you're going to be completing a health risk assessment. They will put together a personalized prevention plan for you. And then that way you can move forward in making sure that you're as healthy as possible. I have the apple there because in the Medicare and You handbook, your preventative services are identified by an apple. So again, the old adage, an apple a day keeps the doctor away. So we want to make sure that, again, if you're in the Medicare and You handbook, that apple has and will identify all the preventative services. And now we're going to talk about Medigap policies. So again, not to be confused with Medicare Advantage plans. Medicare supplement insurance, also known as Medigap policies, are sold by private insurance companies. They fill in the gaps for original Medicare. So your deductibles, co-insurance, and co-payments, some of those costs that we saw on the previous screen, well, these Medigap policies will possibly pay some of those costs for you. And so again, the plans are identified by by letters, which makes it easy for the concept if you're still new and trying to learn kind of what the difference is between a Medigap policy and a Medicare Advantage plan. They're identified by letters, and so the plan letter will provide the same service. Important key points in reference to shopping for a Medigap policy. So that would be one of the differences. If you live in one of the states listed below, they will be called something different. So if you're in Minnesota, Massachusetts, or Wisconsin, they are not identified by letters. And so sometimes folks will have it called something different. So just to kind of recap and look at what we're talking about now, Medicare coverage choices, again, your original Medicare on that left-hand side and then a Medicare Advantage plan. So we are talking about Medigap policies. So again, working with, again, only original Medicare. So we went over Medicare Part A and Part B, and now we're going to talk about Medigap policies. All right, so here you see a chart all the Medigap policies that are available. So there are 10 Medigap policies that are available in your Medicare and You handbook. And it's also listed on page 72. And so this chart kind of shows you all the policies that are available and the benefits that the policies provide. So what's most important is that you understand that the policies themselves are, again, identified by letters. You can see the row that has all the letters. So policy A, D, F, G, K, L, M, and N. So those are the names of the policy. So a Medigap policy N or a Medigap policy F. And then on that left-hand side, you see all of the benefits that the policy provides. And so in looking at this chart and kind of deciding which is most appropriate for you, if you see in the box it has 100%, you're looking straight down the columns for the policy. If it has 100%, that means that it will pay that benefit for you. So some folks actually have Medigap policies along with their original Medicare. So when they go to the doctor, they may not receive any bills. So again, we get a lot of calls from folks that have talked to their family members, or they know folks that have Medigap policies and they don't receive any bills. And so we want to make sure that they understand which policy you have, which benefits are included in that policy, and then we shop for the monthly fees. So which companies actually sell the policies, what those monthly fees are, and then we move on from there. So that is how we normally start to kind of counsel folks in learning about Medigap policies. This chart, again, a good visual to be able to conceptualize what is it that I am purchasing, how does it work with my original Medicare, and then kind of moving on from there. All right, so your Medigap policies do not cover your Medicare prescription drug coverage. There are some existing policies for those that have had policies for many years that may have included a prescription drugs, but for the plans that are being sold, cover drug coverage. And so there is that folks need to when they are thinking about their prescription drugs. And so should you enroll in a Medicare Part D plan? Do you already have some credible coverage from another source? So again, if you have an employer plan that may be credible coverage, you may not need a standalone Part D plan. Again, talking to your benefits administrator at your place of employment. Will you have drug coverage when you actually retire? How much coverage do you need? How much do your current drugs cost, your medications? And then do you have, what are your monthly premiums that you would have to pay? So if you do not have credible coverage from some source, you may be subject to what's called a late enrollment penalty. So part of our counseling we do is we make sure that they understand that late enrollment penalties are something that we're trying to avoid. So if you do not have credible drug coverage from some source, you may be subject to a late enrollment penalty. So it's really important that you have prescription drug coverage and do not go without coverage for more than 63 days. That is when you could be subject to a late enrollment penalty. So again, just making sure that individuals know that you do need some prescription drug coverage if you have Medicare. So let's talk a little bit about Part D prescription drug coverage. What is prescription drug coverage? So again, it is sold through a private insurance company if you're getting a standalone Part D plan. The plans do have what are called formulary lists. So lists of the covered medications that they are providing or give you access to. And then it has to include a range of drugs and categories, things like that. Um, there are some out-of-pocket costs associated with a particular medication. And then if you use what is called a preferred pharmacy within that particular plan's network, your out-of-pocket costs may be lower. And then there is a program to help folks that may not be able to pay some of these costs dealing with their medications. It is called the Extra Help Program and is through the Social Security Administration. So when we provide counseling, we try to screen each individual. We will ask them about their income and their assets to see if they are eligible for this program. And at that time, if they would like to apply, we'll go right to the Social Security website and take their application over the phone. And so it's really important that people, if they are having problems, for their medications and the costs are too high for them, that they call us. And so we could possibly see if they're eligible for this program. So now we're going to talk about Medicare Advantage plans. And so the decision is, should you join a Medicare Advantage plan? You must have Medicare Part A and Part B to join a plan. It is a plan that an all-in-one alternative to original Medicare. They will cover all the same services under Medicare Part A and Part B. There are different types of Medicare Advantage plans, so we'll go over that a little bit also. But the first decision point is, should I join a Medicare Advantage plan? Some of these plans offer additional services. So again, you may see advertisements for dental, vision, and hearing, as well as other services like transportation, home modification, other services that they may offer as the plan provides, or if you join the plan as a member. Things to remember, it does not work with Medigap policies. So we want to make sure that if you're choosing the original Medicare option or a Medicare Advantage plan option, you do not need both. So again, you would not have to purchase a Medigap policy. And then starting next year, end-stage renal disease. So that ESRD is for folks that have permanent kidney failure, your end-stage renal disease. They will be able to join a Medicare Advantage plan starting in January. So again, Medicare Advantage plans are all-in-one alternative. You get your services bundled together. You may have some out-of-pocket, lower out-of-pocket costs than original Medicare. And again, these are the plans that offer those additional benefits, your vision, hearing, dental, and more. And so again, if you're looking for those services, this is an option you would want to explore. In a Medicare Advantage plan, you still have all the same rights and protections you normally would as a Medicare beneficiary. You still get all the covered services from Medicare Part A and Part B, but now the Medicare Advantage plan is providing those for you or help managing that for you. You may choose a plan that has a prescription drug coverage. You can be charged different out-of-pocket costs. So again, depending on the plan that you select, how much you would have to pay out of pocket. But you cannot be charged more than what original Medicare provides for things like chemotherapy, dialysis, and skilled nursing facility care. Again, choosing a plan that has those extra benefits. Some of them include fitness as well as wellness services. And then you may have a yearly on your out-of-pocket costs. So again, there could be a limit on how much you would pay out of pocket for a particular calendar year if you join a Medicare Advantage plan. So now about the decision. I've decided to join a Medicare Advantage plan. Which type of plan do I need to join? So one option is called a health maintenance organization, so an HMO. That is a type of Medicare Advantage plan where you can get your services from the doctors, hospitals, and providers within that network. So you are going to the doctors that are identified by that plan that they have as their network of services. or where you can get services at. And so again, HMO is just one type of Medicare Advantage plan. You will need a referral from your primary to see a specialist, and you will need to identify your primary physician that you have selected. Another option is called a preferred provider organization, also known as a PPO. So this is just, again, another type of Medicare Advantage plan. You will have in-network doctors as well as an out-of-network doctors, hospitals, and providers that you can go to. So again, just a little bit more freedom in network, out of network. Costs would be different also. So if you go to physicians and doctors and hospitals that are in network, it won't cost as much as the out-of-network providers. And then you do not need to choose a primary physician. And in most cases, you will not need a referral to see a specialist. So again, just another option for you as you are looking for a type of Medicare Advantage plan. Now, they also have what are called special needs plans. And so again, a lot of folks might not know about special needs plans as much, but they are an option for you. So if you meet the criteria for a special needs plans to enroll, then that could be an option that might serve you well. And so special needs plans, what you will see here on this next screen are the three different types. They have an institutional special needs plan, or what is called a dual special needs plan for folks with Medicaid. And then they also have the chronic condition special needs plan. And so again, sometimes folks may meet the criteria. They have to call the plan directly to see if they are eligible and to see whether or not they can enroll. And so they are not able to just self-enroll themselves from the Medicare.gov website. They do need to contact a plan to make sure they meet the eligibility requirements to join the plan. But it could be a really good option for some folks that are really trying to manage some chronic conditions. They have a lot of health ailments that they are trying to manage. And so enrolling in a Medicare special needs plan could really benefit them. And then also for those folks that are dual eligible. So what are some of the costs? We get a lot of questions about how much will a Medicare Advantage plan cost? And so we really do have to just go right to our Medicare.gov website, and we use what is called the Medicare Plan Finder tool. And at that time, we will create an account for the person, and then we walk through the 4-step process, putting in their medications, letting them, selecting which pharmacies that they utilize, as well as mail order. And then that last step, just really getting a list of all the Medicare Advantage plans that are available to them. That is where we are going to be able to review those costs, to how much it will cost you for a plan. And there are some plans that do not have a monthly premium. The individual may still have to pay their Part B, that $148.50 starting next year. But some of the plans also offer a monthly Medicare Part B reduction. So they may get some assistance, or they may not have to pay that Part B. So again, it just depends on which Medicare Advantage plan you join. Some of them do have yearly deductibles that they would have to make sure they meet, meaning a health or a drug deductible. And then how much you pay for each of your visits, a copayment or a coinsurance, will again depend on the Medicare Advantage plan. So we do utilize the website on Medicare.gov to provide that information to individuals. So just for a quick recap, we're going to look at what are the differences between original Medicare and Advantage plan. So again, that original Medicare on the left-hand side, your Medicare Part A and Part B. And then we also have, you can select a standalone Part D prescription drug plan. And then we also have Medigap policies. So again, those Medicare policies that help pick up that 80 to 80% that Medicare pays, and then the 20% is what your Medigap policy will pay. And then on the other side, again, you have a Medicare Advantage plan. You are deciding whether or not you would like to enroll in an all-in-one option for a Medicare Advantage plan. Again, those additional benefits. So if you're seeking that dental, vision, and hearing that is not covered under original Medicare, that Medicare Advantage plan may be an option for you. Partly of what we do, part of what we do also is that we are trying to help folks that have limited income and limited assets. So we know things can be difficult at times. If you are on a fixed income and you have retired, you may not have a lot of resources available to you. Health insurance can be quite costly, and so there are some options for you as a Medicare beneficiary. One option is Medicaid. So here in Georgia, that is through the Division of Family and Children's Services. It is our state Medicaid entity, is the Department of Community Health. And so if you are eligible for Medicaid, that could be an option that will work right along with Medicare. So again, if you need to qualify for that or you feel like you may, the Georgia Gateway website, right, www is a Georgia Gateway, then you can apply right online for Medicaid. Then the next program is called the Medicare Savings Program. And this is a program that is a part of Medicaid. It is fully Medicare beneficiaries. It will help pay some bills and co-insurance if you meet the income and asset eligibility requirements. So there are some income limits as well as asset limits. But if you have limited income and limited resources, you may be eligible for the Medicare Savings Program, and it can help pay for some of those out-of-pocket costs. Then that last program, which I mentioned earlier, is called the Extra Help Program. And that program, again, is through the Social Security Administration. That is a program that will help pay for your prescription drug costs, and it will help to reduce some of those out-of-pocket costs that you pay for your medications. It can reduce the amounts down to anywhere about $3 or so, up to about $8 or $9. And then if you have the full extra help, it can reduce it down to about $1 and some change and up to $3 or $4. So again, a really good program, but you do have to meet the income and asset eligibility requirements for the program. And in that case, we do go right to the Social Security website and we can take your application right online. So now we are in Medicare open enrollment. So it started on October 15th and it is soon ending on December 7th. So we encourage all folks to look at their health and drug coverage to see whether or not this is something that they would like to change or switch. We do get a lot of questions from folks asking if I have coverage and I am satisfied with my current coverage, do I have to change? And the answer is no. If you like your current coverage and you like your plan, you have no questions, your plan, and you haven't received any information from your plan telling you otherwise. So again, we do caution folks, if you are receiving mail from your current plan, please open and read your mail to make sure that there's not anything changing that you need to know about. But if everything is fine, then it will continue on for next year. But for those that do need to look at their health coverage during this time or their drug coverage, this is the time of year that you need to do so. It will be ending on Monday, December 7th. So we tell folks, take that time to kind of look through that process. And if you would like to call us to assist in that process, we are here and available to help. So now we're going to talk about scams and dealing with COVID-19. And so we've seen an uptick in reference to different scams as well as a lot of fraud going on dealing with COVID. So one of the scams is a phishing scam. This is where you would get an email from some source that you think is reputable. They may even use a name of some national or international organization that you're familiar with, but it may not be the actual organization. So we caution folks to make sure that before you click on emails that you know the source that it is coming from. Is if a government agency, it will have that .gov. If it's a nonprofit, it will have the .org. So we want to make sure that you're not downloading any malware or anything that can take your personal information and your financial information off of your computer or your laptop or device. Also app scams. So we've seen an increase in scams dealing with apps. So everybody has a smartphone. You may be tempted to download some apps. So make sure you are doing it from a reputable source to get that app and you have some sort of virus protection on your phone. Also investment scams. at a lot. Folks are on the internet more. They're home, they're on the internet, they're scrolling, you're in your different social media platforms. So just make sure that if you see something that's too good to be true, that you do not, give monies to any type of investment scams where they are looking to take your large sums of money from you to invest in stocks or real estate or something that you want to make sure that is illegitimate. So then we also have some testing scams that are still going on now. People were selling fake at-home kits and going door to door trying to get folks to pay for kits and things like that. So just make sure you are aware of that. So now we're talking a little bit about new to Medicare boot camp. So as the state health insurance assistance program, we do provide webinars. So we've been providing webinars now for a while. And so if you would like to learn more about Medicare, there are upcoming webinars for the remainder of the year. A lot of our webinars are during the day, like now. We do have a series of webinars that are on Saturday. So if you would like to participate, as normally on the third Saturday of the month, and of course during open enrollment, we've added another evening session. So for October, November, and December, on the first Tuesday of every month from 6 to 7, there is a webinar. And then on the third Saturday of every month, there also is a webinar from 9 to 10 in the morning. So if you'd like to bring your coffee and your tea, I will be doing that webinar. So you will be joining me in reference to kind of learning about Medicare. During that time, though, I do try to do a demo. So I will go to the Medicare.gov website and show a demo on how to use the Medicare Plan Finder tool. So some key points to remember about Medicare: it is a health insurance program. It does not cover all of your healthcare costs. You do have choices on how to receive your Medicare coverage. And there are programs to help those that have limited income and limited resources. Your decisions do affect how you get your coverage. There are time sensitive. So again, making sure you meet those marks in reference to making a decision. And then we are here and available to help you. So this last screen just has our contact information. It has our 866 number, which is for the Division of Aging Services. It is an automated system. So I just caution people about that. You will hear an automated system. So we put the option 4 there for you so you know which button to press. But there are, if you call that number, you will get access to all of the programs that are offered through the Division of Aging Services. And so again, you press the option 4, you will reach a certified Medicare counselor. We are available Monday through Friday from 8 a.m. to 5 p.m. And of course, you can visit our website or sign up for our newsletter. And we are also on Facebook. So I will go ahead and end. That's the last screen. And so I will turn it back over and see if there are any questions or things that I can answer at this time. So Maureen or David, okay.
Thank you, Christine. This was a great presentation, and I think you crammed the whole Medicare book into one quick, concise presentation. I forwarded a few questions, mostly about the penalties, and maybe we can speak a little bit more to that. But before that, I would like to tell our guests from out of state that GeorgiaCares is, again, the state health insurance program, but you have one in every state that can help with these same questions in the same way. And they're available to the citizens where you live as well. I'd like to introduce our guest with us today, our special guest from the plans as well. Do we want to do that now before the Q&A, or do we want to, I don't know which would work a little bit better. Maybe you could just quickly take the questions that I put up there, and I do apologize. I think I sent them to everyone instead of just to you. And that was, is there a large percentage of the people who neglect to sign up for Part A and then have to pay the penalties and how they're assessed, as well as the penalties for not signing up for Part D? I know we often hear from seniors who say, I don't take any drugs right now. Why do I have to get it? And they mistakenly don't enroll and end up with a penalty. Can you speak a little bit to that?
Yeah, so that's a really good question and dealing with penalties. And so there are folks that are subject to these late enrollment penalties. You could possibly have a late enrollment penalty dealing with either your Medicare Part A, if you have to pay a monthly premium, as well as Medicare Part B, which is 10% for every 12 months that you did not sign up for Part B, meaning that they will add that penalty to your monthly premium, and it can continue for the remainder of your time of receiving Medicare. And so there is like enrollment penalties for Part D also. So even though you may not be taking prescription drugs, you do have to have prescription drug coverage from some credible source. So again, if it's an employer plan or whether or not you sign up for a Medicare Part D prescription drug plan, for Part D, though, those penalties are calculated by 1% times the national Medicare base premium for every month that you did not have a Part D prescription drug coverage. So it varies in reference to what that penalty may be is unique to you. So that's why we try to make sure folks understand that you do need to have the appropriate coverage for yourself to make sure you can avoid these late enrollment penalties.
The last thing I'd like to get on the table is that many times people confuse Medicare and its coverages for skilled nursing.
Mm.
If you could just speak a little bit to the limitations.
Sure. Yeah, definitely. And so we do get questions about skilled nursing or even long-term care services. So Medicare does not cover long-term care services. So if you are needing help or you have a loved one that needs help with activities of daily living, so things like eating, they need help eating, bathing, dressing themselves, using the restroom, things like that, which is called custodial care, basically. They're activities of daily living. Medicare will not pay for that. The title of home health care services can be misleading, thinking that you can get home care in your home anytime and Medicare will pay for it. That is not the case. And so home health care services deal with skilled services that you receive. So if you need physical therapy, occupational therapy, speech therapy, these are the things that are considered under your home health care services. And if you are looking for custodial care or activities of daily living, long-term care services, Medicare would not be a source for you. You would have to find some other source. Now, Medicaid does cover that. When we talk to individuals, if you have VA services, so veterans services, if you have a long-term care insurance policy, that will cover long-term care services for you. So other sources for those that custodial care that people may need. Good question.
Did anybody else have any other questions?
Yeah, Christine, I had a question asked to me yesterday that I've never gotten before. I'm David Burke with Aetna.
Okay.
If someone's already in a facility, a skilled nursing facility or some other place, and I mean, do they get an institution, an I-SNP? Can they get an I-SNP from an agent or do they get that from the institution?
They will get that actually from the agent in reference to who's selling that particular policy. So it's my understanding that the actual facility is not selling any type of insurance or anything. So they would go to an agent to enroll in that. So again, to the company itself to enroll into an I-SNP or any of the special needs plans. So we refer folks directly to a particular company. They have that. I-SNP or C-SNP or D-SNP available for them. So they are going directly to the company to enroll.
SNP meaning
Special needs plan. I'm sorry,
Yeah.
special needs plan. So we went over that briefly. So these are the special needs plan. And so I definitely feel like a lot of folks don't know that they exist or are not as familiar with them. But we try to, as we work with clients, let them know that these are available. They are available on the Medicare.gov website also. You do have to check a button for them to display. And so we make sure that individuals know that they are available, and that is something that they can also inquire about is their option. But we do refer them to the actual plans and make sure they meet the qualifications for them. So not everyone is eligible. There are requirements that they have to meet to join. And so that is why we refer them directly to the company to see if they meet those eligibility requirements.
Great. Well, it would be nice to be able to introduce our special guests from the plans who've joined us today. We know how busy all of you are, including you, Christina. I know it was hard to get you by phone with all the calls that you're taking, but why don't we just go ahead and start with you, David Burke from Aetna.
Yeah, I'm David Burke with Aetna. I'm the broker manager for Metro Atlanta, and you know, we have plans available in almost every county in Georgia, with the exception of a few. But yeah, so I'm with Aetna.
And I see Michael Conforti. You're still on mute. Okay. No. We'll come back to you, Michael. Let's see. Do we have Esther? Okay, Esther. Oh, she would be with you. Okay. How about, why don't I just call out the names of, let's see, Humana?
Morning, everyone. I think we were on double mute. Dino Papadis with Humana, market director for outstate Georgia, every county in Georgia except the Atlanta Metro. We have plans for every need out there in pretty much every county in the state. So if you have any questions, looking forward to hearing from you. Thank you.
Thank you. Are you on, Michael? WellCare? WellCare and Allwell. Yeah.
All right, thanks for having us today. My name is Michael Conforti. I am the Vice President of the Georgia market for sales and marketing. We have Medicare Advantage plans under WellCare and Allwell. We have traditional Medicare Advantage plans, HMO, PPO, dual special needs plans, chronic special needs plans, and standalone Part D plans. So we offer a variety of plans across the state. Appreciate the time today and hope everyone has a safe and happy Thanksgiving.
Thank you. Crystal.
Good morning, everyone. I'm Crystal Finley with Kaiser Permanente here in Georgia, and we have 3 plans that we offer. We offer a basic plan, an enhanced plan, and we have a Medicare Medicaid plan for individuals that have full and partial Medicaid. And we also have 25 facilities located strategically around Metro Atlanta.
Thank you. We have Callie Bradford with Cigna.
Yes, good morning. Sorry I didn't have my video on earlier, but I'm out here at a turkey giveaway for GeorgiaCares. But Callie Bradford, new business development representative with Cigna Medicare Advantage. And we pretty much cover most of Georgia with the exception of a few areas, but glad to be here. Thanks for having us.
Do we have CareSource in the house? What about Anthem? Stacy or another representative? I know some of you have changed the names of your reps since we spoke. So why don't we look at the different blocks in front of us, and whomever we haven't heard from, please feel free to jump in.
Maureen, this is Greg Mercer. Can you hear me?
Yes.
Didn't realize I was double muted earlier. I'm the sales director for Humana here in Atlanta. You heard Dino speak a moment ago. He's my colleague who's responsible for the rest of the state of Georgia, and we both appreciate the invitation to participate. Christine did a wonderful job on her presentation, so well done. While Humana is in the group insurance business as well, most of our business here in Georgia is our Medicare lines of business, Medicare supplement plans, but an even greater presence in the Medicare Advantage space. So like my colleagues from other plans that have spoken, we offer HMOs, PPOs, Part D standalone plans, and we'll become much more active in the SNP world, the special needs plan in recent years. We currently offer a dual eligible SNP plan for people with Medicare and Medicaid. We also are introducing a chronic SNP plan into the market, a diabetic chronic SNP. And in the Atlanta area only, we will also be introducing an institutional SNP for the first time, an iSNP product. And Christina was exactly correct. Our agents are responsible for enrolling folks that are in facilities. We work closely with the facility leadership, but the agents are obviously responsible for enrolling members. So thank you again for the invite today. Enjoyed listening in.
Appreciate everybody's participation. I wonder if there are any other questions. I don't see any in the chat box, but if somebody's sitting on a burning question, by all means, please jump in here. Or if there's another provider that we haven't introduced. And again, I apologize because I know some things have changed since when we spoke. But Christina, I do applaud you. You really packed in all the information that was really important. And it was really important, I think, for people to see who their providers are as well in the state of Georgia. And I know that that varies somewhat from state to state, but everybody together is doing a great job to make sure the citizens remain healthy. We all know that healthy people cost less. That's our mantra. And appreciate everybody's time here today. Are there any other questions? Well, then I'm going to let you go and get a cup of coffee, and thank you so very much.